Dear friends, a warm welcome to today's webinar on dental research and unexplored career opportunities in India. Now, whether you are currently studying medicine or dentistry or are in high school and planning to get a bachelor's in medicine or dentistry, it is important to understand that your avenues are not actually limited to medical practice. You can very well go out in research as well. And this is very important for the advancements of techniques and procedures that may help your fellow practitioners in managing patients. During my research career, I also got a chance to work with a dentist turned researcher, Dr. Hemant Unadkat, and he made me appreciate the role surface characteristics play in the dental stem cell, and his aim was to improve biomaterial integration. Now, this has come from his own experience of treating patients while working in Mumbai. So, working with Hemant made me see the new insight that a medical practitioner can bring into research. But people like him are few in number, especially in developing countries like India. Thus, to discuss these and related questions, we have organized this webinar. So, we have three guests today. All of them started as dentists and now have established themselves as scientists in distinct domains. So, let me first welcome Dr. Nadeem Bijle. He is a pediatric dentist and obtained his PhD from University of Hong Kong. His research interest is caries preventive strategies and pediatric oral health. Dr. Nadeem, welcome to the webinar.
Thank you very much.
Our next guest is Dr. Hitesh Chopra. He is an endodontist and obtained his PhD from the University of Hong Kong. His research interests include, but is not limited to, regenerative dentistry by the application of stem cells in dentistry, such as pulp regeneration in endodontics and bone regeneration for osseointegration in medically compromised patients. And final guest is my dear friend, Dr. Nilesh Dubey. He is a general dentist and obtained his PhD from NUS and is currently working at the University of Michigan on 3D bioprinting strategies for dental tissue regeneration. So let me welcome all three of you to our webinar. Yeah. So let me start by giving you guys a chance to introduce a bit about your research. So can you tell in your lay language what is your lab studying and what you guys are specifically studying? So let's start with Dr. Nadeem.
Yeah, okay. Thank you very much, Kapish, for a very nice introduction. And thank you very much for your question too. I have recently graduated from the Faculty of Dentistry, the University of Hong Kong. And I was studying the role of arginine in caries prevention. And my work is still being continued over there. We have a research team back in Hong Kong, and they are working on the same lines that I was working during my PhD. And so I would say that my lab is currently looking into novel caries preventive strategies that could help in order to prevent caries and masses. What I mean by this is, apart from having the professional care, self-care is where caries prevention plays a major role. So we are trying to develop strategies, self-care strategies that could help people on their own in order to reduce the caries prevalence throughout the globe. So that is what we are currently working on. So that's in lay language that I would like to say my research focus is.
Dr. Nilesh?
So thank you for the introduction, Kapish. I graduated in 2018 from National University of Singapore from Faculty of Dentistry. And currently I'm in Michigan. I'm a research fellow here. And my major research in PhD, I was doing this coating for the implants to increase the osseo integration for the implant. And I realized I want to do more stuff. And then the latest trend was 3D printing. And then I came to University of Michigan. I started working on 3D printing. So my major research focus is, using engineering and nanotechnology tools, stem cell therapies, to make a bioactive material or the scaffolds or a patient-specific scaffold. Second, I'm working on some injectable scaffolds to increase for the disinfectants of the root canal, so that to achieve a predictable pulp regeneration, so patient they don't have to go for a root canal hopefully in future. And third, I'm also working focused on identifying the clinically viable approach to prolong the clinical success of the adhesives, which we use to do the fillings in the clinic. So these are the three major areas. Currently, I'm working here at the University of Michigan.
Thank you. Dr. Hitesh?
Yeah. Thank you so much, Kapish. Thank you so much for giving me a wonderful introduction. I just recently graduated from the University of Hong Kong, and my PhD research interest was the bone regeneration, where we used to evaluate how the bone can be grown in medically compromised patients. So basically, I focused on the osseointegration and how the stem cell can be incorporated into implants so that in a medically compromised patients which have bone problems where the bone cannot grow, like for example in case of diabetes mellitus or after irradiation therapy, we have to enhance the bone growth so that the implants will be stabilized. Otherwise, it's a very big issue. So that's how my research focused on, and we combine the stem cells on the implants, and thereafter we evaluated in the rabbits the osseointegration. So this is all my research which I did in 4 years. So basically, my research also has a long-term impact, not only in the dentistry but also in medicine, because basically right now we need after bone fracture or bone injuries we need approximately 6 months. So any implant, whether it is a dental implant or a normal implant, if we will be able to culture, like incorporate stem cells over the implant and then put it into the place, then it might enhance and reduce the bone healing time. So that is my research and what I did.
Thank you. So I hope this introduction would have helped the viewer to see the diversity in the dental research. Like you guys are using from nanofabrication to microfabrication to 3D printing, nanotechnology mixed, and with a focus on dental research. So moving on, and I'll start this with Dr. Hitesh. Like, did you assume while you were working in the dental school that you'll be going to be a clinician, or that you were going to be doing research? Like when you were doing your dental school, what were your thoughts at that time point for going into research or going into the or continuing the practice?
Okay, so when I just know that I have to be a clinician. Very frankly speaking, we have no idea like whether there will be a research in dentistry or not. So I just have the very one focus, like after my BDS, I will start my practice. Until and unless I went to Saudi Arabia after my 2 years of clinical practice, I completed my graduation, I did my masters, and I practiced for 2 years. Then after I went to Saudi Arabia, there I basically know what is the real value of research and how I can pursue my interest. So basically, in masters, I wanted to pursue my research in the stem cells and its role in endodontics, like the pulp regeneration. But I couldn't do because I don't know how to start and where to start. So I left it like that. But when I went to Saudi, then I know that yeah, I can do that and I can do in these countries. The research facilities are amazing there. So definitely, while in India, I have literally no idea what is exactly research is. I just focused on being a clinician. That's all.
Nilesh, your thought on that? Like when you were doing your BDS, did you wanted to go into research, or you were also not sure that if there is something like research in dentistry, something like that is also there or not?
Honestly speaking, I will share a good story I have for this. Honestly, when in second year of my dentistry, first year my sister got married, and second year of my dentistry, my brother-in-law is a scientist. My father is a scientist. Okay, he's a rocket scientist. He retired 2 years back. And my brother-in-law was a scientist. He was a biologist, epigenetic. And when he was working for the WHO, and on 7th of April, the World Health Organization Day, and we were talking on Skype with him, and he showed me a picture, and he showed, this is a picture of crick. I was like, kya majak kar rahe ho aap? Okay. Simply like, we have studied Watson and Crick, he might have died, right? Long back. But he showed, no, Crick is still alive. And then I came to know, he was 24-year-old when they discovered this double helical model. And after talking with my brother-in-law, in second year of my dentistry, I realized, there is a big scope for a dentistry, for a research. Because in WHO, he was surrounded by medical students, by dental students who are doing pure research. And that time I realized, the real value of research. And in my third year of dentistry, sometime I used to tell my friends, I will go and do research. Pagal hai kya? That used to be the term, like, are you crazy? Like, you are a clinician, right? The research is for masters, students who never got into a medical school or engineering. That was the psychology in 2004 when I got into a dental school. People used to think, the research is for the people, MSc, BSc, jinko engineering and medicine, they haven't got into those fields. But then I realized, the real value of the research. Immediately, I finished my dentistry, and to surprise, I worked on liver cancer. Being a dentist, that was another surprising part. I came to United States in one of the world's biggest MD Anderson Cancer Center, and I was working on the liver cancer. A lot of my friends were like, how can you go and do research into liver cancer? You are a dentist. I say, we are a medicine profession. Dentistry, although we don't consider you as a doctor, but we studied about, in first and second year, we studied pharmacology, we studied surgery, we studied medicine. Okay, we have the common subjects like the medical school. But those guys, they never have these things what we studied as in the dentistry. They have only during the intensive rotation. So I have fair idea, okay, what it is about. And I came into a research and I learned from basic, and I got one publication from a liver cancer. And honestly, that is still my highest impacted research publication of 16 impact factor. I'm working in dentistry from 10 years. I never managed to get that, but my first research experience was 16 impact factor. And then I realized, to do more into a research, I enrolled myself into a PhD program. And that was like not by default. I knew in third year because of my father, my brother-in-law, what research means. And I said, I can make more impact if I know the other side. So that's how I have fair idea in my third year of dentistry that I will go and do research.
Thank you, Nilesh. That would be very inspiring for our viewers. Dr. Nadeem, your views on that?
Yeah, thank you for this question. I think in this question we are missing a term, which is a very rare combination of clinician and a researcher. You see, so very few people in the world, they are clinicians as well as researchers. So we are missing this term. Now, coming back to your question, whether during my BDS days, undergraduate days, I was knowing whether I'm going to be on the research side or not, I think Nilesh knows very well. Right from my undergraduate days, that's third year of BDS, the moment I entered into clinics, I was very much interested in research. I think the first of my projects was on baby crying and its correlation with diagnosis. That's a very good combination of a clinical research, you see. And then I moved on further to my final year BDS on a research topic which was in chirology, that was on chemomechanical caries removal system. So right from undergraduate days, I was involved in research. Now, where this idea of research clicked to me, if you see the name of the institute where I studied my BDS and MDS both, my bachelor's and master's both, it's called as M.A. Rangunwala College of Dental Sciences and Research Center. When I entered the school, that time, I remember there was one guy from the general office who said, this word research center has got a significance which many people don't know. So later, in the years coming by, they will encash. The management is going to encash on this research center. That clicked me. And then later on, when I moved on to my years in BDS, so in third year onwards, when I got exposure to the patients, I thought this is a good chance to do research, because you will not get a clinical material as equivalent as in India, anywhere in the world. We are serving around 1.3 billion people. You see this? With 1.3 billion people, there is so much of clinical data and there is so much of diversity as far as the disease is concerned. So if someone really wants to do clinical research, I think the best place to do that is in India. But the problem is that many of the clinical academicians, as I mentioned, they are not well trained in research. That's why our students, they don't have guidance and they can't pursue this further. Unless you have a great passion of doing it, you go out of the way, then they will support you a bit, as my supervisors did during my bachelor's and master's, and then you can pursue this further. So definitely, I had this in mind that apart from being clinician, I'm also there to solve the problems of the society. So why not combine both of them? And I always say that I want to become in the future, or I am right now, a clinical academician, which is a combination of clinician and researcher. So yeah, that's the answer to your question. Definitely, I was having that in mind. Someone started by saying that getting to know whether SEM is possible during undergraduate days or not. It was possible for me. I did my first SEM when I was in a transition phase from final BDS to internship. I tried to find out which center does that in Pune when I was studying there, and then went there. Although the machine was too conventional than what we are using today, it was too difficult to get the sample, vacuum the samples, sputter the samples, and then get the images. We were not even having an idea how images look in SEM. So definitely with all these exposures, so you have to go a bit out of your way in order to get through that path and then you definitely can. But you need to have that passion. So that is, I would say that definitely I wanted to keep my legs on both the stones. Although it's not good for some people say you should not keep your legs on both stones, but I would definitely want to do that, because with clinical practice you get an idea what is the problem of the society, and you can address that problem of the society by getting into research. So that was the whole idea, and I think to if you ask me, I was definitely interested in being in research and clinics at the same time, right from my undergraduate days.
Thank you. So, viewers, so like you have heard that some of them they knew from the bachelor days that okay, they have to do research, but it can also be happen that when you do your bachelor's and after that you get an exposure like Dr. Hitesh of these immense opportunities in the research, and then you try to go into this field. So either way is fine, but just keep your avenues and eyes open to look for any opportunities that comes your way. So now, moving on, I'll start this question with Dr. Nilesh. So Nilesh, in your experience, how different is research for a dentist, and how difficult it is to make this transition? Like when you're doing a practice, how difficult is it to transition into a research for a dentist?
I think it's a very good question, Kapish, which you are asking. As Nadeem mentioned, in third year, you really need to have a passion. And I know him from 15 years now, and he's the only one I know in my college. He went to do an SCM in third year, although as he mentioned, we have no idea. So very important, the transition is tough. I will say, for the people coming from India, because our education system is crammed with didactic and medical courses, we have to do the quota, the patient quota. We have this rotation, that rotation, and we don't have weekends off, right? Even Saturday we are working. So in United States, we have seen, many people I come across, they have this DDS PhD program. They went on to do research during their dental school only. Even the first, second, third year students. In some foreign countries, they have this program called Europe. In Singapore also, they have this program called Europe, undergraduate research program. So these undergraduate students, they get exposed to the during their dental school to the research. They get fair idea about what research is. And the second thing, as Nadi mentioned, the clinical academician, we don't have people, to help us, train us, unless until you show the passion. I was watching somewhere, some video on YouTube or somewhere, this guy mentioned, everybody will love you, your family, but a sikshak, a lecturer, a professor, is somebody, if you will be a good student, he will go out of the way to help you, to guide you, to make you what you want. And that's what has happened with Nadeem. He was so adamant, so thing that he wants to do. And, the professors will never say no. So the transition is very tough, coming from India with zero knowledge about there is something called pipette. We learn, this image is from confocal microscope, but we have no idea what is confocal microscope. We have no idea about what is SCM. We have no idea. We learn ELISA is a test to check for the AIDS or this hepatitis B, but we don't know what it is, right? We never go back into a microbiome or any book to learn about this process. So definitely the transition is different and it's tough. But I will say, now and during our time, it was very tough. No Facebook, no internet. But nowadays, I can see in India also, a lot of people are visiting, they are presenting basic research. I will say like basic and clinical research are two different things, and I can see in India now people are getting explored to more of a basic research. So I'm very sure the transition during my time was very tough. As I mentioned, people were telling me, are you crazy going to learn about liver cancer research? But I will say research is research. It is a real world problem which you will get exposed to it and you will find the solution to it. It is not something like which we learn, patient comes, we do. You try to find a solution to something. So definitely the transition is tough, but it is not impossible. You can see we three people are sitting here and we have made this possible, and a lot of people back home now trying to do a PhD, to do a research. So it is possible, but you need to have a passion and the vision. So that's what I can say.
Thanks, Nilesh. By the way, I don't think so. You are old enough to claim that there was no internet during your time, but still, let it go.
Your question was how different is research for a dentist, right?
Yeah.
And is it a difficult transition to make? Now, I would like to say one incident. When I was in my internship years, and we were just about to graduate. That time, a new director joined in institute. Nilesh might be knowing him. I don't want to quote his name over here. And I was having a discussion with him. I said, I see something is lacking as far as research is concerned. What he said is, there are two subjects which are not taught in dentistry in India. And those two subjects are research methodology, number one, and biostatistics. If these two subjects are taught at undergraduate level, then definitely we have a better orientation about research. Now, I would like to go a step ahead to what he said. I don't, I agree with him up till here, but the next thing what is required in this entire process is training. If you're not trained as a researcher, it becomes very difficult for you to do research. Very, very difficult, because I have faced that during my undergraduate years and even master's level. So training is very, very important. If there is no training, even the transition process can become too difficult, as Nilesh said. Until and unless you have a passion, and then even if you have a passion, you go through it. But if you don't have proper guidance, it becomes a bit difficult for a dentist to transit from a dentist, a clinician, to a researcher. So you need proper guidance and training in order to support, apart from the knowledge, as our previous director said. And a combination of all will definitely play a major role in order to get success as far as becoming a researcher, transiting as a researcher is concerned.
So I think my next question was very much related to this, and this is again to you, Dr. Nadeem. Like, you all have transitioned from medical practice to research, but your
Right.
focus is still on the different aspects of dental research. So,
Right.
in your experience, is it a good time to get into oral health research?
Okay, if it's contribution to the science, definitely anytime, as far as you're clear in your mind what problem are you addressing of the society, I think it's no time is better or not better. Each and every time is good to enter into research and then address. There are so many problems, as you see, Nilesh and Hitesh. They both are addressing very good problems of the very significant problems of the society. Like Hitesh is addressing medically compromised patients and how it's going to affect their bone growth by his intervention. And Nilesh is also working on similar lines. So you see, there are many problems in the society, and there is a need for researchers to develop new interventions, which is somewhere I feel, lacking in dentistry. As far as India is concerned, certainly it's lacking. If you go to the other parts of the world, definitely things are different. Here, the main focus is on clinical practice rather than research. So, any time for Indian dentists, if they want to transit really as a researcher, the transition period is any time is good. There's no specific time that is good or bad. But if you're talking about monetary gains behind this, if someone is not interested in science but is looking after the other aspect of research, that's money, then I would say this is not a good time because of the pandemic. So once the pandemic resolves, then things might be different. But if you're really passionate about research, you're talking about science, addressing the society of the problem, then any time is good.
Dr. Hitesh, your views?
My views are that first of all, the research is dependent, like whether it is a basic research or a clinical research. So basically, if it is a clinical research, dentists have a preset mind that yes, there are problems, then it can be translated. But again, Nadeem is right. We have to be trained. Without training, nothing is there. And then basic research is like doing some basic stuff like protein characterization and all that stuff. That definitely needs much more patience and much more training, because that will be a totally different aspect what dentist as a clinician is doing.
So I'll add a question to it, and then I'll ask to Nilesh. So one problem with a country like India is that, like, either you take doctors or you take dentists. We have such a large population and so less medical practitioner. Like, per capita, we have, I think, we need many more doctors. So the focus of our, you can say, the government or everything is just to train doctors so that they can treat, rather than those doctors or those people who can do research. So in a country like India, where the first focus in any sense, like even during the pandemic, our first focus was just to save the life. Rest everything will happen just to save the life. So even during with the training, when the entire focus of a government or private players is just to have enough doctors to have a bare minimum health in persons in the country. How do you think it is feasible to have this to include this research into this whole scenario? Nilesh, your views on that? I hope my question was clear enough.
No, as we mentioned, I think like how we can bring the undergraduate students to do more and more research. As we all talk, this is the good time to go into oral research. Literally a good time. Okay, as we can see, as we mentioned, the time was different in 2004. Now we think there is something called interdisciplinary, multidisciplinary research. With the use of like what to say about internet, you can contact with people. If being an undergraduate student, you have a passion to do something, you can approach them. Okay, in your internship we get some lot of free times, you can take some free times out. I know my friend, he during his internship he went to CCMB Hyderabad to do his research, and then he came back after 3 months. He took a sabbatical from the school, and I'm very sure, as we mentioned, the professors, they will definitely encourage you if you are a good student. And so these are the things, so it is very tough, and this is the call from DCI and all of them to bring. I still remember I was working for a company, stem cell banking company, people talking about stem cell, but as we mentioned, now the innovations like tissue engineering, the bioengineering, the knowledge of stem cells have come, and now in the dental curriculum also we have included the stem cells. We never studied what are stem cells, but now in the dental curriculum they have this technology, dental stem cells. Students are learning about tissue engineering. So I'm very sure these are the things which will excite students. And then now there are so many tools available to understand the clinical scenario, to do a clinical research. I remember our time we just used to inject each other to know how the anesthesia is working, whether we are putting on the right position or not. But now with the advancement in the artificial intelligence technology, there are universities in Singapore, they are using this artificial intelligence technology to train students in second year only, to how to inject, because we used to do our patient in third year, and the first trial was on among ourselves before we do these things on patient. So definitely the things is going to change a lot.
So my question was, and I'll focus now to Dr. Hitesh. My focus was on the role of government in all these things. That like the focus of government is still on preventing life and training the people to just be a good doctor or a good dentist, rather than focusing them to become a good researcher. Because again, for as a country with a scale like India, that's the main limiting factors for now. Like first, when you have enough doctors that they can treat everyone, then you think of the next level that of the research. So how do you think because right now, like all three of you, it was your personal, in a sense, personal motivation which led you to research, but it is not something which is promoted by the government itself. So what do you think government could do given all this limitation to improve this in India?
So first of all, I would say COVID-19 pandemic must have realized the government of India that it's a high time now. They cannot just focus simply on being okay. Let's make them dentists, then make them medical professionals, and then we will focus on the research. It should go hand in hand. They have to change their policies so that the dentist or the medical professionals, they have enough of research experience, because it can be handy in unexpected times like this. Indian government has already know that they have a vast potential in other fields. Like for example, they think, oh, they have a very vast potential in mobile market or some other market. But I am not able to understand why they are not realizing India has a huge research potential in research also. Once they will be able to, it will be amazing, and they have to change their policies regarding it. They should expose the new dental undergrads or postgrads to research more rather than focusing after. There is never comes the word after. They should start hand in hand, side by side. That's what basically I understand right now.
Dr. Nadeem, your views on this?
Yes. Well, let's go back and see the stats. See, I don't know much about Saudi Arabia, but let's compare India and Hong Kong. As you mentioned, that the dentist or dentist to population ratio, or the medical professional to population ratio, the physician to population ratio is too less in India. But the same problem also exists in Hong Kong. The problem that India is facing is the population that they are catering to. Okay, in Hong Kong, the government is catering to around 7 to 8 million people. But in India, the government is catering to 1.3 billion people. So there is a huge difference. So allocation of resources has to be a bit smart in order to every sector, in order to means distribute the resources equally or proportionally in each and every sector. But in Hong Kong, since they're catering to a very small population, although they understand that the dentist to population ratio is too less, but they are focusing on that. At the same time, they're also focusing on research. I do agree with Nilesh and Hitesh what they mentioned, that it's high time now that the Indian government should also realize and try to allocate more resources to the population here so that we can benefit from that research and ultimately get interventions that can solve the societal problems. I do agree, and I think government is becoming smarter day by day. And as Hitesh very well mentioned, that COVID-19 was the right time when the government realized the problem, and I think in the coming years things should be okay. But the main problem you see is again the catering of the population. It's 1.3 billion is how much? It's like almost 15% of the entire world's population. So you see, they are catering to a huge population. If that's the case, then definitely it would be a bit difficult on the government's end to allocate their resources more on research rather than the basic clinical needs. So, well, if you see as a comprehensive picture, both the areas, that's Hong Kong and India, both are facing the same problem. But Hong Kong government has been quite smart enough to identify both the issues and then address them simultaneously. But they have an advantage that it's a small place and there is a small population that they are catering to. But India is a large country, it's a huge country, and then there are so many people over here, and then catering to them becomes a bit difficult. That's why maybe the government is allocating more resources to clinical needs as compared to research. But it's high time, yes, the government should realize and allocate a bit more resources, I would say, as a step first, a bit more resources on the research, and then later on, they can involve many other people into the research and allocate more resources as time passes by and the GDP improves.
I would like to add some more what Nadeem and Hitesh said. It is up to the government, but I think it is up to the organizations like DCI and the colleges. They also have to push, because the government is not something, as Nadeem mentioned, the population is too big and we have to serve that clinical need. But at the same time, as an organization, they really have to realize this potential and they have to tap. And as very sure, this COVID has made people realize, how important is research. And I don't know when was the time we all have followed when the vaccine is going to come, right? But whether it is a dentist, is a common person, a person, 80-year-old person who have no idea, but everybody is following about, when these vaccines are going to come. And simply, this will help us give the opportunity for a dentist not to become a clinician, but, if they can become an entrepreneur. I have never heard, when I was in India, that some dental company in India, they have made some dental material. Most of the dental materials which we are using is coming from China, from US, from Russia. If we get this kind of research orientation, we will ourselves become self-dependent and we can start manufacturing our own dental materials for the clinical use. So it is up to the government, but again, it is for the organizations, they have to really push forward to this thing so we can have a better clinician, academician, or an entrepreneur.
To add on to this again, I'll add a personal experience to this. So I'm not sure how many of you knows, but at least in IIT Bombay, either you are a dentist or you have done MBBS, you can take admission in the MTech Biomedical Engineering program directly. And as Nilesh was saying that there is a lack of a dentist entrepreneur. So one of my batchmate, he was a dentist, Amar. So he did his master's. He did a good research. He did a project, and then he started his own company. So again, like maybe this is something which is again coming up in India, where people are understanding this that okay, you are a good dentist, but if you include some of the research experience to it, you can really bloom out into something very wonderful. Now, my next question is also something which I think all of you may associate with, that in India, being a doctor comes with a lot of prestige. Whereas most of the times, researchers or PhD, they are looked down upon. Like I have been asked a lot of time this question: why did you do PhD after your engineering? Like in India, this the people who do the research generally it is the mindset that okay, इसको कुछ नहीं मिला वो ये कर रहा है. Means the person who didn't get anything, he is trying to do research. That's the general attitude. So how difficult was it for you to decide to have a career in research and convince your families? And associated question would be, what would you tell an undergrad student who is thinking about career in dental science and research, but hasn't really made the commitment? And I'll start with Dr. Hitesh.
Okay. So actually, I would like to tell you, like my family, basically, my uncle, he's he's a cardiologist. So when I was getting admitted into Hong Kong, he told me, "Oh, why you wanted to go there and do a research?" As a clinician, he's making a very good amount. You know that how cardiologists are making an amount, right? So he said, "Just leave the research, come here," and because my aunt, like his wife, is also a dentist, so he told me that okay, we can open a clinical chain and something like that, and we will just continue our practice. Because I left my practice, you just come back, start their own practice. So it was, really very difficult to convince him. Even if he is a cardiologist, he thinks that oh, clinician is the best thing. Just sit, make money. It's a very real experience which I have. It was really, really very difficult to convince. Even my parents, like because I had my own practice for 2 years, I did everything. I set up my own clinic, everything I did. So it was really hard time convincing my parents, my family to do a research. But yeah, I definitely feel that if you have the passion to do research, you should go, and it's not like you will lose something. You are gaining knowledge, and ultimately you are addressing some of the critical problems which a patient or a country is facing. So that's how I can end up with it.
Dr. Nadeem?
Yes. Well, to your question, as you mentioned, how to convince the family. Well, since a long time, I think since my undergraduate days, even Nilesh could agree to this. I was always passionate to become a clinical academician. Talking about research, discussing research was always my passion. So it was not that difficult for me to convince my family for that matter. They knew. Although I had a practice from 2008 until 2012, and then 2012 I gave away that practice. But still, I always had that passion to be in academia, do research, talk about science. So for me, it wasn't that difficult to convince my family. They knew that this guy has got a track and then he's following it up. And they had given me all the freedom in order to follow whatever I was planning to pursue. Now, coming down to another question whereby you asked, what would you tell an undergraduate student who's thinking about a career in dental science and research, but hasn't really made a commitment, hasn't really put it on his plate that he wants to do it? Well, for me, at the present moment, I would say that it's very important to have a mindset. I'll tell you one story. When I was in Hong Kong, a colleague of mine, a pediatric dentist, approached me. He said, it's been 2 years that I'm doing consultations all around in Mumbai. And then now I feel that I should join the college, but I really didn't have an opportunity. I said, see, to be an academician, you need to have a mindset. It's very important to have a particular mindset to be a clinical academician. Academia is all about giving and taking less. How much you contribute to the society, you see? And then he said, oh, I realize it now that there is a difference. Otherwise, people here with a specialist training like masters, MDS, they think that they are an academician. They are not. They need to realize there is a difference between a specialist and there is a difference between an academician. A specialist certainly can be an academician, but he needs to be trained in that particular manner or have that particular mindset or have qualifications that support that he is an academician, which is lacking in India. People with specialist qualifications, they think they're academicians. They're not. This is the major thing that needs to be differentiated in the minds over here. Even Dental Council of India, they don't say such things. They think, oh, MDS, you can become assistant professor, then associate, and then full professor after a particular number of years. I am fine with the system. See, every system is unique, and I'm okay with the system. But they need to be at par with the system all over the world, whereby they clearly classify who is a specialist, which classification does not exist in India. Very honestly, let me tell you, we don't have an Indian specialist register. And the other thing is, who's an academician? How do you classify this? which is not yet classified. So if someone at undergraduate level is asking me this question, I want to pursue research, I will say first make up your mind. Understand what is research. Get your basics clear. Go and meet researchers, go and meet clinicians, see who are more appealing to you. Or spend some time with them, one week, 2 weeks, and try to get first hands-on experience as to what research is all about and what clinics is all about. And then make up your orientation and accordingly follow your path. So it's very important to go and be at their place and see how things work, and what suits you, you can then adopt it. So that is what I would suggest an undergraduate student moving further from now who's thinking about doing a research. For some people, research might be very easy. They will pursue it as a game. But for some of them, they will think, oh no, I'm trained as a clinician. I don't want to be a researcher. So for them, research is not there. It's not their game. Let them be out of that path, that route, and then follow the route of a clinician. So that's my answer, Kapish.
Thank you.
I actually skipped. Let me add, Mukesh, because I skipped that question. So basically, if a undergrad wanted to be a dentist, I would definitely suggest that a dentist has always an upper hand as compared to a normal basic researcher, because being a dentist or being a doctor, we understand the clinical problems much more than a basic scientist, right? So definitely, I also agree with Nadeem that a person should have a mindset. If he wanted to be a researcher, I would rather suggest, if he is also interested in being a dentist, first become a dentist and then explore the research opportunity, because then the person, the undergrad or whosoever it is, can understand the problems of the societies in much more lucid manner, much more clear manner, rather than being just a basic scientist and sticking to the research.
Thanks, Dr. Nilesh. Would you like to add something?
I think what both of them tell, I will add. It is, I think for a dentistry, I might not find, like, if persons are not from the medical background, if the family is not medical background, I think it will be easy for parents to convince for a dentist to become a researcher, because setting up a dental clinic is not like just the medical clinic, right? You just have to have a chair. You come, patient consult, but we need to have all the instruments, the dental chair, which cost like bomb, So I think if person have passion and they tell their parents, I'm very sure they will think. And again, in India, long back was the mentality, are daat hai, right? Nobody cares about the tooth. They just go and get it extracted. And I think, if I go and tell my parents, Mom, I don't want to do this because I am not trained for 5 years to extract somebody's teeth. I'm here. Medical, the thing is called, oh, you just cure, you give them, you remove them. In dentistry, the first rule is preservation of the natural dentation. That is what we have been taught. We are there to preserve the thing, So that is what something, I think convincing the parents will be challenging given the Indian scenario. But I think if coming from a middle class background, and if you don't have parents who are from the medical background like Hitesh, I think it will be easy to convince. And coming to the question of, like, for the young person, I'm just going to tell them, try. Either you're going to like it or you're not going to like it. But in this process, entire process, you're going to find out something very valuable, whether you are made to do a research or you're going to be a clinician. I teach students, I have students coming here from India. They come with a big dream of doing a DDS in India. And DDS program here, for the Indian student is like a mess. Okay, it's like a mess. The system is so cramped for a DDS. No, it's so tough for the people. And some people, they come here, they give the exam, they clear the national board, then they go back. They don't know anything. Then the people, they come here, they do the MPH, they have no idea. So, there are things, if you have a passion, as mentioned, you just don't waste, because the research is all about the public money. In short, you are using your own money. So just don't come here for a monetary gain, as Nadeem mentioned, If you have a passion, if you want to do, then only come. And research is, it is like 1% theoretical and 99% of a practical knowledge. You're not going to understand until you're going to do it. So it is very important, to understand, that's what we call science or research, to really appreciate it, you have to do it. And I have found it very rewarding and exciting career. Okay, I'm doing this from last 10 years. And a lot of people contact, how satisfying it is. I am very satisfied. Every day when I enter into the lab, I enter with the mindset, okay, I'm going to do something new, which is going to benefit my colleagues, my patients in coming time. Just sitting in the clinic, we do the technology, but everything needs to come like for a pharma drug. If the people, like as you mentioned, PhDs were before people used to look down, but nowadays, people are respecting PhDs. People are they now as a medical doctor, a lot of people wants to do PhD, and I think it was because of the researcher and the medical people coming together. A COVID vaccine is possible so quickly. I think only one person working towards that, it would have not been possible. But the medical PhD researchers coming together is make possible. So, for the dental field also to progress, research and clinics, should go hand by hand in coming times, for India to progress. So that's what I will say for young students. Just try. You're going to like it or you're not going to like it. But just don't do for try only for a monetary gain.
Thank you. I think this will be very helpful to the students who are thinking of taking a career in research. So before going on to the audience question, I think Nilesh already answered it. So I'll ask Hitesh and Nadeem. So it is being normally said that choose a job you love and you will never have to work a day in your life. So my final question to Dr. Hitesh is, how satisfying was the combination of your research and practice? Uh, your comments, final thoughts.
Okay, so it is very, very satisfying and very rewarding. At least I am able to address one of the biggest problem in the mankind. I will say that the bone loss or the bone in osseointegration. Just imagine after 60 years or you don't have teeth, right? You have some medical problem. You cannot have implants. How will you eat? Your whole life is going to become worse because you cannot eat anything. But with my research, at least you will have an implant, you can have a bone growth. Ultimately, you have some stable implants where you can eat. Not only that, addressing the dental issue, but also in medicine, like bone implants. So I am very, very satisfied what I did, and I hope to continue with my research.
So Nilesh, do you have anything to add? I think you already answered this part, but if you have anything to add.
I think like that's why, like as Nadeem also mentioned. Again, I will say the same thing. It's very important for a clinician at least to do some basic research. We are capped to do the things, and it is satisfying only because I know a lot of master students back home. They do their research only to get a degree, and they have no idea what they have done, and those papers they don't get published. So I think during that time it is very important. So when you will be sitting in clinic, and when you will understand, oh, you have done this root canal 3D root canal cleaning, and then you can, in your master thesis, if you have done really this well, like SEM and all those things, so I'm very feel like it will be more satisfying when we talk with the basic researcher who have no idea and they are working into a dental research, and they think something very uniquely. So that's the thing, if as a clinician, it is a very satisfying for me, and I will just advise this to a master or a graduate students, whoever trying to do a research, just do this from your heart. Try to understand, you will solve big problems which is happening into the community, from a research point of view.
Dr. Nadeem, your views?
My view is definitely it's very satisfying to do research as well as clinics both at the same time. What I would like to emphasize here is if your research, your basic research, can be translated very well into your practice, that's the most rewarding and most satisfying thing. You see? So if I remember having a conversation with a scientist in Hong Kong, and he said, if your clinical intervention that you initiated in lab is used by at least 30% of the population, that means it's a success. You see? So definitely it's very satisfying, it's more rewarding. What is more rewarding, again, it's additional rewards you get when your work gets appreciated and is used by the masses. Your lab-based intervention that you created is used by the masses. So definitely it's very, very satisfying, no doubt.
Okay, thank you. So let's go to the audience question, and I think we have one question, and it is because our audience is a mix of a dentist and young researcher. So the question is like, if you have to, do you need to become a dentist to pursue a career in dental research, or a basic scientist can also become a good dental researcher? And I think I'm sure like the labs you have guys have been working is like a mix of a population of the people who are dentists and who did biology or engineering as their undergrad. So your inputs on that, and I'll start with Nilesh.
I think you don't have to be a dentist to to become a dental researcher. I have very good colleagues of mine from Singapore, from Michigan, from Hong Kong, from other places. They are a basic researcher, and they have done well. I will give one example. I have a very good friend from Singapore. Like when we do the caries removal, जो cavity बोलते हैं ना हिंदी में कीड़ा निकाल रहा है, that's what we tell our patient, and we remove. There is something called caries, and to check that during the patient, that guy, he's not scientist, he's a biomedical engineering, and he's developed something, a pH base. So you just have to put that thing and it will become a fluorescent. So you will see the caries is still there or not. Nowadays we have endoscopic microscopes, okay, but still you cannot make a difference among some caries. So you need some kind of dye. So he was working on those stuff. Then I have a friend here. She's a textile engineer working on clothes, all the things. And then suddenly she decided to do more into a dental research. And she's using a technology called melt electrospinning and electrospinning technology to make these injectable fibers, to inject into the root canal so that, the disinfection, rather than using those antibiotics which are in high concentration, which can kill the cells in the canal. Because nowadays what we all talking about is the regeneration process. For a regeneration, we need to have the cells. So this girl, she's a textile engineer and she's working on this thing. So I will say it is not, anybody can be a researcher. Research is one field, you don't have to be a medical and doctor. You just have to have a passion, you have to have a knowledge, and research is like, it's something which you learn in 4 years. You don't have to be a dentist, or any basic person with a master or business degree can enter into a dental research.
Thank you. Dr. Hitesh, your final views?
I totally agree with Nilesh that it does not need to be definitely become a dentist or a medicine to be a researcher. You just have the passion. If you have a passion, you can apply your previously gained knowledge to become a researcher. So definitely you can be a researcher, just you have to be a passionate. How to find the solution of a problem.
Okay. And Dr. Nadeem?
Yes, certainly. I agree with Nilesh and Hitesh that you need not have dental qualifications to do research in dentistry. I remember very recently there is a postdoctoral fellow who's recruited in Hong Kong U, who is from pharmacy background, and he is doing research over there. What differs here is the application. If you're a dentist, you will have more clinical orientation. But if you're a basic scientist, you will talk more about the physical, chemical, other properties of the intervention per se. And you would be much more sophisticated, and it means you would have much more sophisticated knowledge about how to design those interventions. I would always say a combination of both is very good, but that's very rare. I remember a colleague during my BDS days who had finished his engineering and then he came into a bachelor's of dental surgery. That's but it's very rare, even in Hong Kong U. I know some guy who did his master's in dental materials and then he was going back in order to do chemical engineering or mechanical engineering. So there are combinations as such, means whereby they have basic knowledge in both the fields in dentistry as well as in other basic fields, but that's very rare. But yeah, certainly it's I agree with what Nilesh and Hitesh said. So there's no need for means qualification. A basic qualification does not make you a researcher or not a researcher. You can be a researcher. That's an independent field. It's an independent entity. What differs is the application.
Okay. Thank you. So with this, I'll thank all our guests who came here, gave their time, and I hope that this discussion will help our audience, and they will find it illuminating, and it may help them in their own journey. So with this, I'd like to end our today's session. And to our audience, if you like our content, please like us on our Facebook page, on our YouTube page. Please share with your friends and relatives. And if you have any ideas about the subsequent lecture series, then please let us know. Thank you.